Okay, and if you want to go ahead and get the introduction, Keegan, we are good to go.
Yeah, sounds great. Good morning, everyone. As Chief Executive Officer, Sarah is responsible for the overall management of community crisis services and food bank in Iowa City. For the past 20 years, Sarah has worked in child welfare, criminal justice, crisis services, and youth services in both Colorado and Iowa. Throughout her career, she has led many successful community-wide strategic initiatives, implemented innovative programs to address barriers for those experiencing crisis, as well as developed programs to address the root causes of poverty to help individuals and families not just survive, but thrive. Sarah is particularly passionate about working with law enforcement to divert those experiencing a mental health crisis away from the criminal justice system through mobile crisis response and law enforcement liaisons embedded within local departments. Thanks for being with us this morning, Sarah.
Thank you, Keegan. Okay, so I will share my screen. While I have slides, they are a bit dated because we're not too far into 2023, and I'm not big on reading off of slides anyway, so they'll just kind of give me touch points to talk to you all about the programs and services that we offer at Community Crisis Services. I'll start off by saying a lot has changed for community in the last year and a half. I'll talk a little bit about 988 and the expansion of that effort, the increase that we're seeing in demand for food bank and financial support services in terms of rental assistance, security deposit assistance, utility assistance, and the law enforcement liaison programs that continue to expand in law enforcement departments. So our mission, Community Crisis Services, is a volunteer-driven organization, which means we rely heavily on our volunteers, particularly in the food bank and financial support programs, to meet individuals' needs for emotional, food, or financial crisis, and we strive to do so in an immediate and non-judgmental way. These photos, we are housed in, right now, 4 different facilities. So our food bank was expanded during the COVID pandemic. It used to be located on Gilbert Court. It is now moved to Pepperwood Plaza in the Southeast District. So it's over where Slubberland used to be, and the new diversity market is going in, and the post office. And that's provided a significantly larger space and a client shopping model so that they can shop for the foods that they need for their household. GuideLink Center is over by the Waterfront Hy-Vee, and it is a 24/7 facility access center for mental health and substance use. It is available to anyone in the community. Community Crisis Services operates the triage portion of that center. So we are the first point of contact when someone comes in to seek help. The services that are offered after triage are 23-hour crisis stabilization, 3 to 5 day crisis stabilization beds, medical detox, and a sobering unit. Those are available regardless of insurance status. And they're also voluntary services. It's not a locked facility. So food bank and basic needs. We provide produce, bakery, deli, dairy, health, baby, hygiene, non-perishable items. It's a completely free and confidential service. We request information because funders like to have the demographic information. However, that is not a requirement to receive food. So we really strive to make it a low to no barrier access point for folks. We get food to people in a variety of ways. We have shopping hours where they can come to the center and shop. We make sure we have evening and weekend hours available. We have a mobile pantry that goes to food deserts in Johnson County and places where people might not have transportation so that they can get food from our mobile pantry. And then we also started food delivery during the pandemic, and it's a service that we have continued, and it's highly utilized. In FY21, we distributed over 1 million pounds of food and served 3,900 families. We're seeing about a 30% increase from that right now as demand continues to increase at the food bank. So our basic needs financial support program provides a lot of the staple services that folks need in the community. So there are various ways to access utility and housing assistance. We are a funder of last resort when it comes to rental assistance. If you don't qualify for Johnson County General Assistance, then community might be where you would go to get rental assistance. A good example that I use for that eligibility criteria for Johnson County General Assistance, you cannot be a student at the University of Iowa. So that means any non-traditional or traditional students are ineligible to access that funding. So services like ours are important for those populations that don't meet the criteria of federal HUD, which is often shelter house housing assistance and Johnson County General Assistance. We provide help with water bills, gas and electric, security deposits. We do a lot of helping folks get the identification they need that becomes barriers for housing and employment. So birth certificates, Iowa ID. Our Cultivating Careers program is one that I'm particularly fond of. If people are starting a new position and they need steel toe work boots or tools or a laptop or the fees to pay for their certification for their CNA license, anything that they might need that's a barrier to them starting that employment, they can come in and meet with somebody and access assistance for that. And that program's been growing pretty significantly in the last year and a half as well. We offer bus tickets, gas vouchers, and clothing vouchers. We provide temporary mailing address for folks. So if they are homeless or, not unhoused or not in a stable housing situation, they can use our address for their mail and come and pick up their mail. And then we also do prescription medication assistance. In FY21, we helped about 1,700 individuals with rent and utility assistance, 6,300 with baby items. And then our box fans is something we do in the summer when it's really hot, and we distribute those through the food bank. So crisis services. So we like to, all of our services are crisis related, whether it's economic, food insecurity, emotional and mental health. But when we talk about our crisis services, we're mainly focusing on the mobile crisis response program, GuideLink Access Center, and crisis intervention. So crisis call, chat, and text is something that's really expanded in the last year and a half. So we have been a provider on the National Suicide Prevention Line. There's 2 centers in the state of Iowa that are National Suicide Lifeline providers. And in July 13th of last year, that transition happened so that people can call a 3-digit number, 988, or text 988 to reach a crisis counselor immediately. Community Crisis Services is a state 988 provider, which means that all calls, texts, chats that originate in Iowa are routed to one of 2 Iowa centers, one being Community, the other being Foundation 2. And then we are also a national backup center for chat and text, which means when local centers like the state of Iowa centers aren't able to get to a chat text in time, it routes to a network of national backup centers, which we are one of those centers. So in FY21, we had about 33,000 total contacts, 7,600 contacts addressed suicide. That is probably going to be double for FY22 with that national backup. And one of the things we've seen with 988 is the ability to text 988 has really increased the volume of texting that we're seeing. And that tends to be individuals age 15 to 24 prefer that modality of accessing a crisis counselor. One of the things that's new that's going on with 988 in the state is our ability to warm handoff if a call, chat, or text intervention isn't going to meet the needs of that individual and they're interested in having a mobile crisis response team come to them in person. That is something that we would be able to do off of 988. In April, we'll be starting 911 to 988 diversion. That's something I'm very, very excited about. So Johnson County, Muscatine County, and Black Hawk County in Iowa will be piloting that. And what that means is if someone in a mental health crisis calls 911 because they're not aware of other resources, but it's not appropriate for a law enforcement response, they can be diverted directly from the 911 dispatch center to a crisis counselor on 988 for that most appropriate level of intervention. So it's really great that Johnson County was able to get into that statewide pilot and be one of the 3 first counties. GuideLink Access Center, I talked a little bit about this. The collaboration is between Community Crisis Services, Abbey Health, Penn Center and Prelude, as well as Johnson County Ambulance Services. And then the goal is, if we can divert someone away from the emergency department and divert someone away from jail and they're able to access what they need at the GuideLink Center, and that's what we're hoping to provide for the community. So in 2021, the fiscal year 2021, there was about 725 intakes completed by triage counselors. Mobile crisis response. Mobile crisis response is dispatched anywhere in the community where help is needed. There's virtually nowhere that we will not go. We are available 24/7, 365 days a year. One of the things that is really important to me when I'm talking about mobile crisis response is that people know this is a service that's available to everyone in the community. It does not matter if you have insurance, if you don't have insurance, if you have excellent insurance, if you have subpar insurance, what your socioeconomic status is, there is no other service available to people like mobile crisis that can come to your home or wherever you are in 60 minutes or less to provide you with that support. Our mobile crisis counselors are experts in suicide prevention and intervention. They're highly trained to do suicide assessments and screenings based on best practices and make sure that people get the appropriate level of intervention. Something that I really like to make sure people understand about suicide prevention is folks often tend to lean towards the liability side of things and get scared when suicide is brought up. And so they take people to the hospital. That can actually be fairly detrimental. One of the statistics that I find most compelling is that the rate of death by suicide is highest in the 48 hours post inpatient psychiatric hospitalization than at any other time. And so that is not always the best or correct answer. There's a lot of speculation in the suicidology community around why that might be, but we suspect it's because there's a lack of follow-up and you're not there for very long. So you're experiencing a crisis, you go in, your insurance may only hold you there for 3 days. They won't authorize more than 3 days. That's not enough to see if any of the medications are even going to help stabilize you. You come out, you were hoping for help, you feel hopeless, and then there's no follow-up. So that's where we really try to get people to utilize MCR, even if it ends up in a hospitalization, which it rarely does. They're now hooked up with mobile crisis counselors and they're going to get weekly follow-up after that hospitalization to make sure that they're getting the ongoing support that they need. So it's a really important service and I just can't say enough about it. And our counselors do some really incredible work there. So there's a number of ways to access these services. We have call, chat, and text through 988 and the NSPL website. GuideLink Center is at 300 Southgate, and that's the 688-8000 number. I like to make sure people are aware of that. I just bumped into someone yesterday that was completely unaware of that, and the individual had been considering inpatient and didn't know about GuideLink Center and ended up going there instead and was really pleased to know that it's voluntary, and if they decide it's not for them, they can leave. And so I think that it's a really important resource for people to be aware of. For mobile crisis, that's dispatched through the Your Life Iowa statewide line. So currently it is that 855-581-8111 number. And you call that number and say, this is my situation. I'd like to request a mobile crisis response. And then they dispatch counselors out. And then you can see this is dated, and we don't have our 2023 one because crisis call, chat, and text is now the 988 phone number. So that's kind of an overview of our services on the slideshow portion of things. I'm going to minimize you guys so I can get to my, did I stop sharing?
Yeah, you
Yes.
did.
Okay. So I wanted to give you some of the information about where we're at year to date for fiscal year 23. So to give you an idea of how significant this volume is, we're halfway through the year and we have engaged with 34,828 individuals. That is through 988. That is through, I also didn't talk about the University of Iowa emotional support line, which is really important. So Community Crisis Services answers for that line as well through chat, text, and phone. We have on Lifeline, which is 988, about 77% of folks report feeling better as they're getting off of that chat, text, or phone call. And then we have for mobile crisis this year to date, we've had 674 contacts, and of those, we have 199 youth served. I think that one of the things that's been really wonderful as we've been focused on youth mental health is we have a youth mobile crisis program coordinator who's been able to put a lot of work into outreach. And so we increased our contacts with youth through mobile crisis by 400% over the previous year. Our law enforcement liaison program is something I wanted to expand on a bit too. So we currently have 2 law enforcement liaisons that are employees of community, but embedded within the Iowa City Police Department. We have a 3rd law enforcement liaison that responds to calls from the Johnson County Sheriff's Office, the City of Coralville Police Department, and the North Liberty Police Department. And then we serve Iowa County as well for mobile crisis. And we just hired a law enforcement liaison that will respond with the 2 city departments and the county sheriff in Iowa County. So those efforts have been really significant and made a difference in a lot of folks' lives. Just for ICPD alone, so far, we've been at about 170 dispatches where a mental health counselor has been able to respond along with law enforcement. So I like to, one of the things I like to say is if somebody calls 911 for a mental health crisis, they may now get the added benefit. They're expecting a police response, but they may now get the added benefit of one of our crisis counselors being there as well. And then we're stepping that up to divert from 911. Hopefully when people call, then we'll also be able to divert directly to a crisis counselor and perhaps mobile crisis response. So there's a lot of exciting things happening with crisis services and in terms of making sure people are getting the right intervention at the right time, the right level of intervention, and of course, diverting those with mental health away from law enforcement and the criminal justice system as much as possible. So that is kind of the general overview of who we are and what we do. The other thing I might add before I can open it to questions is that the growth that we've seen in the last year has been pretty remarkable. We went from an agency of 82 employees to currently having 229 employees. So that is the kind of growth that we've experienced with the expansion of 988 and providing that low barrier access number for people to be able to reach out in crisis. So it's just pretty exciting to be able to see all the ways that we're able to show up for people when they need us and where they need us. Does anyone have any questions for me?
Okay, thank you, Sarah. I'm gonna actually, before we take questions, I'm gonna stop the recording just for some privacy.